Hey guys, welcome back to Nashville Neck Back. I am Dr. Roberts, and we've got another awesome reaction video for you again today. This one specifically comes from Loki Fishit. Hopefully I'm saying that name right. She's a viewer that sent me several videos to take a look at. But when I saw the thumbnail for this one, I knew I just had to react to it. So anyway, that's what we're going to get into right now. All right, guys, so we are going to react to Dr. Ernest Kim today. And again, thank you to Loki Fishit who sent this to me. I will link her YouTube handle down below. If we take a closer look here at Dr. Kim, he is a second-generation acupuncturist, chiropractor, and massage therapist with a psychology background. So he's studied quite a bit in both Western and Eastern philosophy. So all kinds of stuff. So these videos should be fairly interesting. I don't think it says where he practices, but if you take a look here, he's got 72,000 subs, several hundred videos. So I'm sure his videos do quite well. But specifically, we are going to watch this one. Chiropractic patient has severe scoliosis with Harrington rods. And you guys will see the thumbnail once I put this up. But his original thumbnail for this just caught my attention right away. If you don't know what Harrington rods are, that is when a younger patient, usually in their teens, maybe even early 20s, has scoliosis. And if they catch it soon enough, or if it's severe enough, they may need to surgically install these basically metal rods that run up and down the patient's back. It's a major procedure. It's not ideal, but if you have to have it, it can be a lifesaver. And the x-rays, sometimes if you've seen this, they're freaky looking. But the only reason that this got my attention is because on the thumbnail, it showed the x-rays, it showed the Harrington rods, and it just had me wondering, please, please, please tell me this chiropractor is not going to go in here and try to adjust her thoracic spine or make any kind of weird, crazy promises that he's going to fix her scoliosis. Trust me, I've heard all kinds of crazy stuff, especially when it comes to scoliosis. So anyway, I don't want to ponder too much about what we could possibly see. Let's just go ahead and dive into the video and see what we have.
Wow, it's so clean. Welcome back, Michelle.
Hi.
How have you been?
I've been really good. I've been great. Actually.
Yeah?
Yeah.
You've been great. You've been working a lot?
I've been working a lot. I've been working on a lot of different things.
Okay.
I've been back to set.
Okay. What are you doing on set?
I am a stunt woman and an actress. So a lot of
awesome
stuff, everything from driving cars to pretending to drown to working with horses and weapons.
You ride horses?
Yeah, yes,
Wow.
yes.
So if she has Harrington rods and she's also a stunt woman and she does horseback riding, there's no telling the damage that she's put her body through. She would be a challenging chiropractic patient for sure. That's pretty awesome that she's been able to do such a physical, active job with having to deal with everything that she's had to deal with.
I do.
How's that been for your body?
Difficult, I'd have to say, because as we've seen in the last footage that we did, I'm fully fused from top to bottom. So I had childhood scoliosis. I had severe scoliosis with 72 and 75 degree, I think it was. Anyway, severe scoliosis. And I was fused with the Harrington rods from top to bottom. And basically that was when I was 13. So everything that I've done since then has been with the fusion. So for horseback riding, that gets a little difficult because it puts extra strain on my hips. Everything that, gets compounded is kind of focused into that area because my spine, doesn't compress or release really on its own. So I take all the pressure and all the impact in like one area. Okay. So my hips get sore and I tend to overcompensate sometimes with different parts of my body. So.
Okay. So what do you got going on today? Neck probably tight?
Yeah.
Back?
Neck is tight. Lower back is fine right now. I've been doing a lot of lower back release.
Okay. We're going to work on all of this then. Neck, upper back, shoulder. Sound good?
Yes.
Did you say something else? Your forearm or your hand or something?
Yeah, so my forearm. So additional to like being back to work, I'm also completing my program at HMI, College of Hypnotherapy. So I've been doing a ton of online schooling. Yeah. And I feel like between constantly like looking at my monitor and typing and writing and and then also now being back in the gym and trying to work on like these muscles specifically, like upper body. Okay. The combination of it has just put a ton of stress from my elbow down to the wrist. So
maybe we'll do some scraping. today.
What's that?
Use a tool to kind of scrape into the muscle layers deep inside, yeah.
Okay.
All right.
Let's do it.
So let's get started.
Seems to be a requirement if you're going to post YouTube videos or chiropractic YouTube videos. Let me try that again. If you're going to post chiropractic videos on YouTube, it's almost like a requirement that you do the scraping.
I'm going to just do a quick exam on you. I know your body, you've been here, but I just want to do a quick check because I feel like it's been a little bit since I've seen you. So
it has.
your neck is a little bit compressed. All right, so we're going to decompress you. We will use the Y strap today to pull, just stretch only, right? And then getting in here, I'm going to loosen up the scar tissue buildup here in your upper back, traps. You know, people call this a shoulder, but really our shoulder joint is here, but we can say shoulder here, right? But I like to call this your upper back or your traps. And then your mid back is really tight. And like you said, low back isn't really tight, which is surprising because you have rods down your spine, but I don't know how you manage to keep that part loose. Sometimes when I work on the body, I get tuning into your energy field, okay?
I like that.
Usually happens on the first visit, more so than other visits, but today I'm getting something from you.
Fun.
You want to know?
Oh, of course I do.
It feels...
Well, that didn't take long. I can only imagine where this is going to go. Oh, boy. Can we just repeat that? Just in case you weren't paying attention, let's just back that up. Listen to that again.
But today I'm getting something from you.
Oh, hold on. Let's go back.
Body, I get tuning into your energy field, okay?
And we as a profession wonder why a good percentage of the population looks at our profession as chiropractors as quacks. The medical profession doesn't take us seriously most of the time. The legal profession doesn't take us seriously most of the time. A lot of the general public who hasn't been to a chiropractor or doesn't know anything about chiropractic sees something like this, and their immediate reaction is going to be, why in the hell would I ever go to a chiropractor? Because they're going to feel on my traps, they're going to touch my neck, and he's going to tune into my life and be able to crystal ball my future here. This is what makes me mad. And this is part of the reason why I do these reaction videos is I love our profession. I love what we provide to the people that come see us. We provide a great benefit for patients that are in acute, chronic pain, and all kinds of stuff. The other thing that's great about our profession is that we are free to practice however we want to practice, and you can go a million different directions with how you treat and how you practice, basically. The problem with that is you get stuff like this and some of the other stuff that I've reacted to is it just goes well far and beyond. I don't even know what normal chiropractic, real chiropractic, legit chiropractic. It just transcends reality. And you get these people that start to make all these claims. And then you get somebody that's curious about chiropractic and they get online and they look up chiropractic and they're curious about it and they want to know about it. And stuff like this is the first thing that pops up and they watch it and they're like, well, I'm not going to go to the chiropractor. It just makes me so mad.
I like that.
Usually happens on the first visit, more so than other visits, but today I'm getting something from you.
Fun.
You want to know?
Oh, of course I do.
It feels like something related to moving or a big purchase or finance. So
All right. So, Dr. Fortune Teller here is maybe she's going to read her palms next or bust out some tarot cards. I don't know. Maybe she should go buy a lottery ticket after her visit. Let's see what happens.
To me, that could signify either buying a home or moving or some type of investment. Do you relate to any of that?
I have been thinking about what my next move will be for purchasing a home, maybe in Hawaii.
Wow.
There you go.
It surprises me every time. Okay, so I feel like you're kind of carrying that here. All right,
Okay.
So that's good stress though, right?
Yeah, it's exciting. It feels like there's like momentum and movement going for a future.
Maybe you're overthinking it. You're overstressing a little bit to the point where
It's
you're
like
carrying
that
it in your shoulders.
lady that used to be on all the daytime talk shows.
Yeah, it could probably be, you have the A where your starting
what's her
point,
name?
and then
I have to look
like
that
B, it's the in between where you're like, how do I get to B?
Yeah.
That's the
talk
point
to-
that I'm probably carrying.
It can be stressful for sure.
People in the
It's a big
audience,
move,
she would talk
but
to their dead
steps
relatives.
to make it happen. So you like Hawaii
She's on
that
like
much,
Oprah
huh?
all the time.
I love
or
it.
Dr.
Yeah,
Phil.
I don't think I'll ever fully leave LA because this is where work is and my family, and I like having my connections still here. It's a good home base, but I would like to split my time in Hawaii.
Wow.
Hawaii feels more like where I grew up.
Are we even going to watch
Better.
Chiropractic,
I like
or is this
Oahu,
guy just
but I
going to
need to see the other ones
do
too.
fortune
But
telling?
Oahu was where there was more work,
So
and I
ridiculous.
really like the North Shore. But I'm also open to seeing the other islands.
Let's do one more. I'm gonna hold it for you. Let's go this way.
I want to be in an area where there's more land than people.
I just noticed. Some of you may have noticed this already. If you go back to one of my more popular videos, her necklace is a perfect tie-in to one of our more popular videos on the channel. Hopefully Dr. Kim here can align her yin and her yang after he reads her fortune.
So,
Okay.
there's other islands with more of that. I think it just is like
So it's gonna be like your tropical escape.
pretty much. But I'm also looking to do as much community service stuff as I can out there.
No way.
I don't think
Like
it's well. I would love to help the community out there with their entertainers, and then the people who are pursuing film but need more resources for training and
What
education.
else are we doing
I do
here?
a lot of that work here in LA.
One
I don't
more.
necessarily need the.
All right, let's jump in
Feel
here.
that?
Yes.
Man, you can take pain pretty well. How about right here?
All right, some just trigger point work to get those muscles loosened up.
Yeah, actually,
Pretty
you actually feel
standard.
pretty good in the upper cervicals, which last time you really stuck in
Cervical
your upper.
palpation.
So let's go face down. So this is a scar where the rods are, and what I want to do is I want to loosen up the muscles here, her erectors and also her
Please
latissimus
don't
dorsi. So
Hammer away on
go
her
ahead
thoracic
and
spine. Please
do
tell
a
me he's
few
not
of
going to do
these
that.
guys like that. Bam. And I'm going to start here. The lat muscle is a huge muscle in the back.
Come on, focus
And
on.
I'm trying to just get the fascia to release. And when the fascia releases, the entire back will start to open up and be less crowded for her.
Okay, good. So
I'll go a little
hopefully,
deeper.
if I heard him correctly, hopefully he's just going to be doing some muscle work on her thoracic, and I'm guessing her lumbar spine as well, and hopefully not adjusting those areas. We'll see. Because again, with those Harrington rods, it's a brick wall. You're not going to be able to do anything.
Under
So
the lat, into her erectors.
adjustment.
How you doing there?
Good.
She's got high pain tolerance, so she can handle this. A lot of people might be a little too much. Relax, good. She's really tight right here. This is her erector spinae muscle right in there. Whew. You okay?
Mm-hmm.
Give me like 3 more. I'm gonna focus a little more right in here. 3, 2, and 1. Good job. Okay, now we're gonna get into first rib. So normally after I open up the lats, I'd go in and adjust the mid back, but because she has rods, there's no adjusting going on through this part of her spine. But we can adjust.
Thank you, Dr. Kim, for being super intelligent about that and not doing what I thought you were going to do when I saw your thumbnail. And I was afraid we were going to watch this video and you were going to just start slamming away on her thoracic spine. Thankfully, that's not going to happen.
Here, the first rib up top. Let your arms drop for me. Okay, good. Take a deep breath in. Coming right here, first rib. Nice. One more time. Good. Good. Let's go on this side. Take the same thing. Deep breath in.
So what he's doing here, if you're not familiar with chiropractic, he's adjusting your first rib. So everyone knows your ribs wrap around and connect to your sternum. But your first rib at the very top comes around at a different angle. And when that thing gets out of place or stuck or it's not moving properly, it can be a bear. It can be super uncomfortable. The adjustment's super easy. He's doing it face down. A lot of docs like to do it face up. You can do it all kinds of different ways, but this way is a very effective way at getting that first rib adjustment.
Gotcha. Right there. Good. You okay? Mm-hmm. Now, let's have you lay on your left side. For this, I just want to get.
And the cool thing about doing it that way is you don't have to
hip stabilizers and your
put your hands in places where they don't need to be.
Loosen this part up. So let's have you kick back and forth like that. I'm gonna hold you right here. Boom. Oh, there he's popping. Pop, pop, pop. 5 more. So for this one, I'm getting into her hip flexors, but I'm also gonna start here where her ileocecal valve is. Sometimes we can hear some bubbling, gurgling sounds. That's good. That means we are actually adjusting that part of the intestine. So just go ahead and relax.
You're not adjusting the intestine.
Did you hear that? Mm-mm. I heard it. Yeah, they're like little quiet sounds. Okay, good. Now, we're just going to get into your hip flexors a little more.
Okay, he had a mic down there on her waistline. I was like, how's that even getting...
So lift your arm over your head like that. Breathe in for me. Breathe out. Do you feel a stretch there?
Yes.
Yes, she does. Good. That is the adjustment there. Wow, I really hope we got that. Wow, that was cool.
That was
good job. Holy moly. Nice, good job. You're really good at breathing and relaxing and allowing your muscles to elongate. So, and on her SI joint, because there's no rods there. It's just the hip and SI joint. We gotta be real gentle, and it's just right in here.
So with that, again, the Harrington rods go all down her thoracic spine into her lumbar spine, but her SI joints are totally fine. They should and do need to be adjusted. What I have experienced with patients like this is you've got to be very careful, very slow, very smooth, and most of the time very light with your adjustment, because if you start cranking away and rotating that lower area, it can be super uncomfortable for patients that have those rods. Again, some may have more tolerance than others. That's just what I've seen. We'll see how forceful or how light he goes here with this side posture adjustment.
Deep breath in and out. Good.
Yeah, that was like light as a feather.
Switch sides. How'd that feel?
Good.
Scoot back towards me a little bit. Boom, bop. Kick your legs back and forth, please.
So it looks like he's just going to do the exact same thing on the other side.
Oh, tighter on this side, eh?
Yeah.
So real specific for you right there. Good. You okay?
It popped as he came up.
Oh, it did?
Yeah.
Oh, crap. Lay flat. I didn't hear it. Lay flat on your back. So first, we're going to stretch out the muscles here, the scalenes, the S.D.N.Y, and the suboccipitals. Those are the top 3 neck muscles that I work on the most. Right here, we're in right into the suboccipitals here. Just trying to mobilize it, break up the adhesions in there. This feels really nice. It's like a deep stretch, deep in the back. Not bad. How's that feel?
Good.
And come here. Very nice. So now we're getting into scalenes. Go this way. So now I'm going to get into her scalenes a little more. Is that tender? Mm-hmm. Super tender. Yeah, it's really tender on people. But she can handle it, so I'm going to keep grinding on it. She can take it. She's used to it. See, the right side's way better than the left. Do you feel a difference?
Yes.
It's probably still tender, but maybe not as much. And of course, we're going to go all the way into the attachment points here by the rib. The nice thing about this work is it's kind of tender when you're doing it, but afterwards you feel like you can breathe better.
Oh, it's fantastic.
Your neck is longer. It actually shapes and makes your neck a little slender in your jawline. Believe it or not.
Keep doing it.
Yeah. I wish I could do it on myself. Very nice. Very nice. Look at that. It's already slim. It's crazy. Not that that's the point, but it's a nice little side thing that comes with it.
That's always the point.
Oh, okay. I didn't know that about you.
Not all of us have the genetic Korean jawline that you have, Dr. K-pop.
Now that her muscles are loosened up, we can do some adjusting. And of course, the rods start at the base of the neck going all the way down, so there are no rods in her neck. So we can safely adjust the neck without any problem. So bring your ear to your right shoulder for me. And then we got one right there. I gotcha. Slide your head to the left.
Oh.
That was a good one.
Oh.
She felt that.
Wow. I feel like you just put my head back in the right place.
Yeah. And we got two more up top. Let's see, one, and then this is occiput. So same thing, slide your head towards my left hand. Mm. That was deep in there.
Mm-hmm. I felt that in my right eyeball. Literally, like, I feel it right in here.
Wow. So we're done with the neck adjustments, but we're going to use the Y strap to traction her. No adjustment because we don't want to adjust down to her thoracic.
So this guy knows his stuff. Super happy. When I heard him mention the Y strap earlier, I was kind of worried because
I don't know.
You take somebody that has those Harrington rods, you put a Y strap on them, you yank them halfway off the table, you could do some damage. But he said he's just going to kind of do a little bit of traction on it, so let's see what he does here. Very smart.
Go ahead and open your mouth for me. Okay, not bad. Open. Feel like it's a little tiny bit restricted, so let's do this. Go ahead and open for me. Close. Open.
Ow.
And then for this, you're going to shut your jaw like an underbite. Yep, repeat. Really tight right here on the right side, yeah? One more time, please. Breathe in real big and relax it. Really relax these muscles. There you go. Now, I'm going to check the joint of your jaw here. Open your mouth for me and then just relax.
So pretty basic TMJ assessment, and it looks like he's going to adjust one or both the sides. If you ever get popping,
same. It's moving good.
Popping, clicking, or worst case scenario, if your jaw gets locked in like the open or closed position. But most of the time it's patients that come in as they're chewing, eating food, they feel the popping, the clicking going on in one or both sides. Typically, what I've seen is it's responds pretty quickly to chiropractic care. One, maybe two adjustments. TMJ issues usually resolve unless it's something that the patient has ignored for years and years and years. Or even worse, if you like grind your teeth at night. Those are situations where sometimes we need to do some additional muscle work on the inside, as well as like I said earlier, if you grind your teeth, you may need to get a night guard. All those things are different factors, but like I said, if it's just something where it shows up every now and then, or it's not a huge complaint, the adjustment usually fixes this issue pretty quickly.
So now go ahead and open your mouth. Yeah, a little more, huh? How does it feel for you?
Yeah.
Okay, good.
Actually, that's wild.
Let's do this. Okay, lift up your head.
I don't know why I ever do my hair when I come here.
And then I'm actually going to strap you down like that.
Man, the chiropractor office is so weird.
Okay, so again, for this, we're just stretching only. And I want you to do some nice deep breathing. And I'm just leaning my whole body weight back and just allowing her body to stretch at her own pace.
Which that alone feels amazing to most
her
patients.
Neck is slowly starting to
without
elongate.
the
Slowly starting
significant
to get
thrust, or pull, I should say, not thrust.
How about maybe 3 more, just like that, Michelle? How was that?
Good.
Okay, so cool.
I could feel it like in my upper back.
I was worried, like I
I'm gonna do
said,
your extremities. I don't
when he
think we've
mentioned
done
the
this
Y strap
before.
earlier,
No, we
he
haven't.
just
I should free you though.
yanked her head off.
It's kind of fun though.
Well, you've been restrained before.
Maybe.
Okay, let's see. Okay. Any tightness through here?
Definitely in the chest because I have scar tissue right there, right now.
Let's get in there.
I was going to do something on her
Feel that?
Yeah.
forearm.
Nice. Love it.
That hand one felt so good.
The wrist?
Yeah.
Yeah. Let's do the shoulder on this side. Yep, kind of leave it like that and come right there. And I have to distract you out.
Oh. Oh.
Feel that?
Yeah. Oh, that felt so good.
Yeah.
Yeah.
Gives you a little space.
Yeah.
Did you feel it in your clavicle or
Behind.
behind? Okay. Great. Let's do your hips. I don't think we've ever done the hips either.
No.
Like this. First. And squeeze your knees together really hard.
Patients are always amazed when you do that. It's like, how in the world did that even happen? It's the easiest thing ever.
Wow.
But it usually gets a reaction like that.
We haven't done it. Okay.
Obviously they needed
That
it.
was great. Let's do the hip pull. I think you're gonna like this one too. So relax, relax, relax. Give it to me. I gotcha.
A good old-fashioned leg pull, which is very effective. Patients
Sorry,
usually
Marty.
love the way that that feels as
Basically
well.
yanking your hip. Did you feel that? What'd you feel?
Everything.
Got the 8-away scraper, and I'm gonna put a little bit of CBD, and we're gonna scrape.
Fascia scraper?
Yeah, and then we're gonna kind of, it's heated too. We're gonna scrape through here. Okay, so I'm gonna apply a little bit of lotion. And put this guy on. So how does that feel? I'm gonna go gradually. Go gradually deeper, but how does that feel right now? Ooh, you're feeling that, huh?
Yeah. That's nice.
Let's go here. How does that feel?
Good.
Do you feel it?
Mm-hmm.
Do you feel the heat? Mm-hmm. Okay, how was that?
Good. I like it. I like the heat.
Sit up for me. How do you feel?
Good.
All right, looks like we're done here. Overall, pretty good. I'm thankful that he didn't go slamming away on her thoracic or lumbar spine because of her Harrington rods. His adjusting was pretty spot on. His communication was great. He seems to be very knowledgeable. It just drives me nuts when you see and hear the stuff that we saw and heard in the initial part of the video. Like, come on, man. Like, I don't know. You, if you're watching this video, leave me a comment below. Is that something that you would want from your chiropractor? Is that something that you would want from your primary care, for them to be able to palpate your cervical spine, your traps, your shoulder, and all of a sudden be like, you know what? I feel like I can read your future. I feel like you're about to make a large purchase in life. I mean, come on. That is so bizarre. Stop doing that. Stop. Just stop. Or if you're going to do it, don't put it in the YouTube videos for everybody else to see. Because again, somebody that doesn't know anything at all about chiropractic, somebody that's very curious, could be sitting at home on their couch in severe pain and be like, maybe I should look into chiropractic. And they get on YouTube and something like this pops up and they see that and they're like, screw that. So Anyway, just my 2 cents, guys. I hope you enjoyed this reaction video. Once again, I'd like to say thank you to Loki Efficient for sending this to me. We will be doing some more here in the next few days. I know I've got a lot of people that have sent recommendations in, so I'm trying to get to them as quickly as I can. I promise you guys. But anyway, thank you guys for watching. We will see you in the next video.